the options for treatment are a lot wider and a lot better. Like if we treat it when it's just a centimeter, your long-term survival is really quite good. And so the question is always like, well, how do we find those? The best study, and the one that drives a lot of what is happening now, was something called the lung cancer screening trial. So this was a huge study that was done in the United States where they enrolled 50,000 patients. They had 25,000 people get CT scans once a year for 3 years, and 25,000 people get x-rays. And then they tracked those people and found how many cancers did they find. And the study was overwhelmingly positive for getting CT scans. In the original study, the relative reduction rate of death from cancer was 20%. Which, to put that in context, that is a better improvement than what we see with colonoscopies for colon cancer. It's better than mammographies for breast cancer. It's better than Pap smear for cervical cancer. This was an incredible finding. But the problem with that study, and this is where kind of our technology started coming in, is when you look at that study, like I said, there were 25,000 people that got CT scans. In that group, they found 600 and some change cancers. They found 11,000 nodules. So 11,000 spots, but only 600 cancers. And what that meant is that all these people who had these CT scans, 1 out of every 3 of them had something on the scan that needed to be followed up on. So that was a 96% false positive rate. And that's not great. Really, we were looking for like, okay, well, how do we still find those cancers, but get rid of all this extraneous junk that comes along with the CT scans? And around that time, there were a couple of researchers at University of Louisville who had developed a test looking for tuberculosis. And essentially what they had done is they had taken essentially a small microchip and coated that with a special chemical that traps some of the chemicals that are in your breath on the chip. We looked at that and we thought, well, maybe we could use this to identify patients with lung cancer.